We are a nation in freefall, in a crisis of historic proportions. Nearly 3,000 Americans reported dead in one day, the most since the coronavirus pandemic began.
The U.S. is under a national state of emergency.
The first death from coronavirus here in the United States.
The pandemic is getting worse.
Coronavirus officially hitting the U.S. Here's what we know.
COVID cases are on the rise as the Delta variant is spreading all across the country.
The U.S. adding 1 million new infections in the last week alone.
Nationwide, hospitals are near or approaching capacity.
Governor Kemp has extended the state's public health emergency.
We have our first confirmed case of COVID-19 in Columbus, Georgia.
The number of confirmed cases continues to surge.
The CDC now reporting more than 440,000 new COVID cases on Monday. That is a record.
It kind of all began for us in March of 2020. We were seeing COVID patients come in through the ER, but nothing like was what we would see on TV. Simply because of what we do. We're not a trauma center, so the really sick patients were in other facilities. That started to change for us with the second wave of COVID. We actually, I think, experienced what other hospitals experienced. And it was, we were not accustomed to that.
There was so much that was unknown about COVID-19. It was overwhelming in a lot of different ways. You know, the patients were coming in large numbers. They were very sick, and we didn't really know what to do for them. It was hard to tell which ones were going to do okay and which ones weren't early on, because they didn't, at that time, had not really identified the true risk factors for progression to serious illness. And we didn't have a way of treating them at that time. So I saw patients as young as in their mid-30s pass away from this, and felt helpless to do anything about it. So it was tough. It was very tough.
The times were difficult. They were different. So you had to take it day by day. For a group that is very good at controlling their destiny, there was no control. And I think that's really what penetrated the soul of everyone, and the fatigue was the lack of the ability to take a circumstance and bottle it up and say, here it is, okay, now we have it.
To walk down the hall and see nothing but ventilated patients in our hospital, very sick patients, patients that we knew were gonna die, nurses that knew those patients were gonna die, that was hard. That was hard to see. It was very hard to see because we knew their families couldn't come in. And it was hard to see, and I didn't want to get emotional, but it was hard to see because I knew we were only doing as much as we could to help them, but patients needed a higher level of care than we could actually offer. But there was nowhere to send them. No one could take them. And everyone was trying everything they knew, but knowing that everything we threw at these patients, everything we did, every medication, every treatment, it really wasn't going to make a difference in the end. It was really just prolonging the inevitable. And knowing that was very hard to see.
I don't recall ever going home and felt as defeated as I did at times during this pandemic, because we just couldn't get our fingers around it. Some of the patients who we lost, left it was really difficult.
I'm Abigail McLeod now. I am currently the data quality coordinator and educator for the emergency department at St. Francis. During COVID, I was a charge nurse, clinical staff on the floor. At first, you're not sure what people are gonna be like. You're saying, oh, it's really bad in New York, and they have vents in the hallways, and that'll just never happen here. We're not gonna get to that level. And then again, a few weeks later, we're at that level. I think it felt very hopeless at times. I know I used that before, like we were drowning in death. You are coding people, they're coming in sicker and sicker and sicker, and you get 5 codes a day, 6 codes a day, however many codes a day, and people are just dying. And if they're not dying in our ER, they're dying in our ICU, where they did everything you could do for anyone for days and even weeks, and they were hopeless because all they see is death. We never see anybody get better. We don't get to see people leave. We're just seeing the terrible side of everything. I don't think any of us processed all these emotions that you feel. And I don't want to say this about everybody, but I feel like most people have some amount of trauma that they have not even begin to deal with yet from all the situations that we had to be in.
What I really saw was, particularly in our critical care units, they were just devastated by what they were seeing in critical care units. And our emergency department was overwhelmed with patients. It broke my heart to see people in such need, and we could not care for them the way that we were used to caring for them because we were just overwhelmed with the number of people.
There wasn't enough of us to give them. I couldn't give them everything they needed. And I think we all knew that. I think the community knew that. And one day I saw a mother who had said goodbye to her 2 sons here, young. And I thought, no mother should have to do that.
We really didn't have time to sit back and go, wow, that was really hard. And one interesting thing that happened was after the first wave of the pandemic, when our census, our volume of patients, COVID patients, finally got down to what was a reasonable number, maybe 8 to 10, and people started to relax a little bit, that's when we really started seeing people start to fall apart.
My name's Sam Martin, and I'm a pharmacist. I work at the John B. Amos Cancer Center, and I split roles between working in the infusion room, and then I also work in the specialty pharmacy, which dispenses and follows oral chemo. I remember in January of 2020, when they canceled the Chinese New Year, I remember thinking, this is not going to be good. I can remember when the numbers started hitting hundreds of thousands of deaths. That was hard. And I remember thinking, we'll hit 1 million, before this is over. When you take a patient who has cancer and you add in this complication of them living with that and now having to live in a world that is everyone around them dealing with a pandemic, it definitely adds a level of stress for them that we have to address by trying to sort of allay their fears, because a lot of it is just anxiety.
Coming out of the gate with the pandemic, there was so much unknown. It changed day by day. The very first part of the pandemic, it was very much learning a lot of lessons quickly and applying those lessons in real time. But there was a different need that occurred as the pandemic went on. And you asked, what kind of message, was I trying to send? It's okay to hurt. It's okay to be affected by having a lot of your patients not make it. And one of the things we tried to do to answer that need is to make sure there was counseling available, pastoral care available. That really became kind of the predominant, what can we do to make sure our people are taken care of? Not just that they have what they need to do their job, but that they're taken care of.
Okay, good to see you too.
The first stage of the pandemic, it was chaos because we did not know what was happening. And I wanted the staff to know that as we are taking care of other people, it's crucial that we take care of ourselves, because if we're not taking care of ourselves, we're not going to be able to take care of the patients that come in. A lot of times people forget about the fact that the people who care for people, that they're people too, that they have struggles. And I feel like that is one of my most important duties, right alongside of the patient, taking care of the people who take care of others.
I grieve for the families that are still here, the husbands, the wives, the children, the caregivers, but I also have a sense of relief for the people who are no longer suffering, because it is hard to watch them suffer. And I think really just allowing myself to appreciate and value that they aren't suffering anymore, that I believe personally they're in a much better place, that they are in a paradise where they feel no pain, that they're nothing but smiles and they have no memory of the suffering they had here. That helps me cope a great deal, and it's very reassuring.
When I look back over the last 2 years, one of my biggest takeaways is that healthcare workers' resiliency and the way they can step up and meet a need day after day after day when things are constantly changing, and still be warriors. I think I've always known that, but it has just been so solidified in my mind over the last 2 years.
You think about those frontline workers and you think about they put aside their safety and they took a risk to their own life to serve their fellow human being. And the willingness to take that risk for others can't be honored enough.
With some reflection, you realize how resilient you are, how resilient our team was. It's honestly appalling some days that people just keep showing up and with good attitudes and smiles and the willingness to want to make things better and the willingness to want to make people have a good time while they're being taken care of. I think it's resiliency.
They're still heroes. The signs might be down, but they're still heroes. They're heroes every day. They always have been, and they always will be.